All right, whether you injured your knee from trauma or some kind of injury, or your knee is just gradually getting more and more painful and swelling, whatever it may be, this video is going to help you determine if you going to see a doctor or not.
Right.
If you hurt your knee or it's just getting so bad that when you walk, when you put weight on it, it's
Right.
painful and you're limping.
You look like Dr. House.
Right. And let's say you are not getting better. If you're limping one day and the next day
Right,
it's better, that's
right.
one
Or
thing.
it
But
feels like it's getting better.
yeah, if it's getting worse day by day, or if it's very painful, you got to go in and get it checked out. Swelling. You know, it's not unusual that you injure your knee or it swells, and
Right.
that doesn't mean you should go into the doctor. But if you've got a knee that's swelling where it's just the dimples are swelled, that's one thing. But when
Right.
you've got it, so it looks like you've doubled the size of the girth, looks like a watermelon, then you should get in.
Right.
Get in, get it checked out. Or if the swelling is getting worse day to day. Yeah, we're talking about, do you feel unstable?
Right.
So you're walking there, it's not painful
Just
particularly.
doesn't feel right.
Yeah, and
Gives way.
these are two things that are commonly happen. Either that extends back this way and it's
Right.
like, oh,
Right.
and then puts you at risk for fall, Bob,
Yeah.
and then you don't want to compound it. The other thing is the quads may give out because of the pain,
Right.
and they'll make you go down like this.
Yeah, exactly.
And it'll come just like that sometimes.
Right.
And then down you go.
What a surprise.
Yeah. So if you got buckling or hyperextension that I tried to demonstrate, make sure you get in because it's going to lead to, particularly with elderly people that may not be able to catch themselves and really have a problem. Put your knees next to each other. They should look about the same.
You can actually find the edges of them
Yep.
and see where they're at, how they line up.
Right. If you got one kneecap that is over a
Way
half
over.
inch compared to one, and usually they do go to the outside direction.
Right.
And then when you bend it, it's painful associated with that. You should get in. Popping, grinding, crepitus, all these things that something's going on in that knee.
Right.
And-
I think that's fine, but if it is associated with pain, get in.
Right. I mean, I've heard people's knees crackle and pop,
Right.
so you can hear it across the room, and they feel
Rice Krispies.
yeah, and they feel no pain,
Right.
and I don't get excited about
It's
it.
been going on for years.
Right. But all of a sudden you get pain, particularly sharp pain associated with that. You should go in, get it checked out because something
It's
needs to
not
be
right.
right. It needs to be
Something
looked
is
at.
amiss.
Don't be stubborn.